Hello, my name is Enia Fernandez. Today I will be talking about a case study about the Lover's fracture. I hope you guys enjoy it and learn from it.
The case study is about a 35 years old construction worker who was brought in by the ambulance to the emergency department. He was reported to have fallen from the height of approximately 4 meters and landed onto the concrete floor below his feet. He was found conscious by paramedics but in obvious pain, holding his right leg up. The first step to follow is communication with the patient, which means personal information. It is essential because the patient can give valuable information about their symptoms and how they feel, this which can help save their life. In this case, the patient is suffering from a fracture called Lover's fracture. Patients with calcaneal fractures are often present in extreme pain, but the precise cause of their pain may not always be found. You should also anticipate swelling of the ankle or heel, along with bruising. The injury typically happens bilaterally due to dropping process. Most patients cannot bear any weight on the affected extremity. Another critical factor is to explain the patient with details about every step for each procedure. In this case, the construction worker had fallen from approximately 4 meters and landed onto the concrete floor. And this means that the patient won't be able to walk. The next step is to transfer him in a wheelchair or stretcher. This type of fracture can create problems in the spine and legs. Many x-rays are going to be taken to know precisely how to deal with this type of accident. The first x-ray should be a calcaneus. That way the radiologist can diagnose if there are more injuries. The first position is plantar-dorsal axial, in which entire calcaneus from tuberosity to the talocalcaneal joint is demonstrated. I will use this projection because the patient is in supine or seated position. Another projection is mediolateral. The position is recumbent on the affected side, knee flexed with unaffected limb behind to prevent over-rotation. Anatomy demonstrated will be partially superimposed talus and open talocalcaneal joint. In cases where calcaneal fracture was not visible on a straightforward X-ray, doctors should calculate buccal angles and guidance vital angle. If buccal angle was below 20 degrees or critical angle was noted to be higher than 140 degrees, a calcaneal fracture will be suspicious. The angle of buccal is much more diagnostic accurate compared with guidance critical angle. However, both diagnostic techniques are now considered out of date. After the radiologist gave the diagnostic, the emergency department initial treatment target is based on enough pain control, immobilization, and wound care, including antibiotics when signs of an infected wound are present. In conclusion, Lover's fracture is one of the dangerous fractures of the foot. Several problems are met with the treatment of such fractures, including the reconstruction of the articular joint surface, the rear facet, and the preservation of a healthy, non-infected soft tissue covered from the fractured side with a natural foot form. In this case, the patient should come every week to see how the fracture is healing and if it's healing properly. Bones are the most important part of human body.